Tamari, kia ora, hera mai, malorsi fu manuia. Good morning. How are you, Doctor, this morning?
Nā mai haere mai whakatau mai, e pai ana. I am good, thank you, and good morning to you also.
Good to have you on the show this morning. Thank you. It's our first interview of the year. Did you have a great Christmas and New Year break?
Yes, it was. It was a very productive Christmas, New Year, a little bit of time with family.
Yeah.
I actually volunteered some time in the Cook Islands as well, working in a clinic there with one of the weeks. So yes, it was, but also good to be back into full swing.
Yeah, thank you. Good to hear that. Okay. Were you shocked with the cabinet reshuffle earlier this year, Doctor?
Oh, so as the Prime Minister said, yes, I was disappointed, but I can completely understand the Prime Minister was looking for a different cadence than what I was bringing, and I'm sure Minister Brown will be able to do that. So once we'd figured that out, then it was with excitement to move into the new portfolios that he's asked me to take responsibility for.
Yeah, the concern, for me as a Pacific Islander, the concern is that because we were proud of you, you're a Māori, and no one knows what is good for our Māori and our Pacific Island people than someone who is a Māori or Pacific Islander. And do you support Simeon Brown as a Minister for Health?
Yes, absolutely. He's a very capable minister, and Simeon will bring all the skills and resources that he has to that portfolio.
Yeah. Okay, good one. Let's talk about, there was staff reduced from May last year, I think, Doctor. How is the ministry cope with the less staff at the moment?
So there were required reconfigurations across all of the public service, because what we know is that in the previous government, the public service had expanded quite significantly, and many times without obvious benefits in productivity or efficiency and effectiveness. And so all of the ministries were asked to relook at their staffing. We did the same with the Ministry for Pacific Peoples. We were able to make the required reconfigurations, and I'm convinced and confident that the ministry is effective in what it does and its objectives.
Yeah. Okay, Doctor, the Prime Minister of New Zealand, Christopher Luxon, keeps on saying the coalition government aim for the future is economic growth. How can you see that in your ministry? In the Ministry for Pacific People?
So the Ministry for Pacific People has a number of objectives, and a very clear objective is to increase the economic outlook for Pacific peoples and reduce the cost of living. And this is across a range of endeavours, not the least of which includes how we can help Pacific people move into their own homes, how we can build financial literacy for Pacific people, how we can help them in the business environment. And all of these things are absolute imperatives and align very closely with an economic growth agenda. We want Pacific people to be a part of that economic growth agenda.
Yeah, okay. Doctor, I want to ask you, did you receive any report, the latest report from the Manawanui ship back in
So that goes to the Ministry of Foreign Affairs.
Yeah.
But obviously the Ministry for Pacific People has deep relationships through Samoa and through the Pacific Islands. And so we receive anecdotal and unofficial reports from family members of staff members, etc., who are here. But the formal reporting comes through Defence and comes through the Ministry for Foreign Affairs.
Yeah, why I'm asking you, Doctor, because the people of the villages that were most affected because of the oil leak from Manawanui keep on complaining, and they keep on asking for compensation from the New Zealand government. Any update from that perspective?
No, that sort of advice will come from either the Ministry for Defence, the Ministry for Foreign Affairs, or the Prime Minister. That doesn't sit inside of my portfolio, which is mostly domestic looking for those Pacific peoples who are in New Zealand. How can we help them have the best outcomes?
Yeah, okay. It's only the second month of the year, 2025. What's your view and what's your plan for the rest of the year?
Sure. If I look at the portfolios I now have responsibility for, we're in the middle of the start probably in the past 30 years. And at the economic growth agenda going for growth that Minister Willis announced about 2 weeks ago, one of those pillars was science, innovation and technology, which I now have responsibility for. So it's a very exciting time to be able to rebuild and realign the science agenda towards government priorities and economic growth.
One last thing I want to ask you, Honourable Minister, please. Are you concerned about the 3 naval ships from China around the Tasman Sea? I mean, this is your part as a Pacific Minister for Pacific Peoples. Are you concerned about the influence of China in the Pacific at the moment?
So you've heard the Minister for Defence and the Prime Minister talk about the vessels off the coast. They have provided the authoritative view. My particular focus is inward looking at Pacific peoples in New Zealand and how we can help them be a part of the economic growth agenda, how we can help them reduce their cost of living. So yes, of course, we're aware of the vessels in the Pacific, but the Minister for Defence and the Prime Minister have that in hand.
Okay, Honourable Minister, thank you so much for your time this morning.
My pleasure. Good to speak with you.
Thank you. Dr. Shane Reti.